Welcome up Alexandra Greenhill, doing her talk, The Surprising Sources of Health and Happiness. Thank you, Alexandra.
Hi, everyone. I thought at the end of a long two-day weekend, I could do without slides and share with you a couple of things that I think are really, really important. So my hope is that everyone out of here will walk out with at least one insight into something that can make you feel healthier and happier. I'm a family physician for almost a couple of decades now, and I love helping people. And early in my practice, I realized that one-on-one wasn't going to do it, because when I started practicing at the end of the last century, we had a national conversation about what we collectively as the healthcare profession, physicians and administrators, wanted to see happen by 2020. It was 2020, a little pun, perfect vision. And so we got together in Ottawa, they pulled us from all over the country, and we had a big weekend debate, brainstorming, and they said, please be forward-thinking. So I pitched the idea of, by 2020, us walking around with tricorder devices and be able to scan people like Star Trek, and then the only reasons people would need the healthcare system would be accidents and childbirth. Everything else is solvable by tricorder device. And then the rest of the room went silent, and they said, but what are we going to do? We need patience. And I said, oh boy, am I in the wrong conversation here? And so I discovered over the next 20 years that that was not an exception, that was the norm, that the thinking within healthcare is this incremental improvement. Can we get things better 2%, 3%? And some of that is reflected in what you see every time you go to see a physician or the emergency room, that essentially hasn't changed that much in the last 20 years. Fine, there's a computer on your desks, but so what? Has that tremendously improved our ability to help you when you're having a problem? In the meantime, just as all of our gadgets tell us we're doing better in terms of health, I see more and more people not feeling great. So we send them tests, they come back, perfect health according to some measures of bodily function, and yet feeling unhealthy and feeling unhappy. And so some of the speakers today earlier alluded to some of those factors. We are now way more isolated than we've ever been in the history of our cities. And so statistics show that 10 years ago, 10% of us lived alone. Now it's 30%. It's tripled in 10 years. When families are asked, how do you feel on a daily basis? 10 years ago, they used to say overwhelmed 20% of the time. And in the last decade, that has tripled as well. It's 59% according to the last poll done in December. And so isolated, overwhelmed, that seems to be the way a lot more people are describing their days. And so what can combat that? What kind of actions, what kind of things can society do? Decision makers are becoming more aware, and there's more and more great ideas, like those community pools, they're organizing events, but those bigger things will happen at their own pace. But in the meantime, there's a number of things that I know if you introduced in your daily lives, you will feel better. One of them is laughter. You can literally laugh away and stay away from the doctors by engaging more often in that activity. So the difference between smiling and laughing is tremendous. There's muscles that get engaged in your body when you laugh, your diaphragm and internal organs, and a number of things get produced within your biomarkers that increase your happiness. And they've done research on that in the States in terms of the impact of laughing, and in 24 hours measuring biomarkers, and it's amazing. It feels better than like an extra 3 hours of sleep. Looking at something positive. They took monks who meditate all day, and they showed them an hour's worth of images of disasters and wars and collapse and negativity, and then they measured their biomarkers of health, and they had all decreased. And so consciously choosing to spend an hour looking at something uplifting and positive can have a tremendous impact on your health overall. Other simple things like listening to music you enjoy. They did a fascinating study to me, because I've had tons of patients say meditation doesn't work for me. It completely failed. And so what happened in that study is they took people and they said, what's your favorite music? And first they gave them meditation music for about 20 minutes, and they measured brain waves. And then they gave them their favorite music. And sometimes their favorite music was heavy metal. And they found that people's favorite music induced a greater state of well-being than anything else. So find what works for you, and if you feel happy at the end of that, it's probably the right tool for your health. A sense of purpose, being aligned in your day and doing something that connects you stronger to the direction of what's meaningful to you, dramatically improves your health and well-being. And finally, and perhaps most importantly, a sense of connection. For many years in the States, there was a city called Framingham where they measured a whole bunch of outcomes in terms of health, and they couldn't find anything that was dramatically statistically significant until somebody who was a statistician, not even a clinician, crunched all the data and discovered that the biggest predictor of success, health-wise, was being married. The biggest single thing that anyone could do, despite of everything else, genetics, lifestyle, accidents and disease, was being married increased your chances of survival. Having 3 or 4 good friends you see often and you describe as deeply connected with also increases your chances of survival. Helping somebody else, doing something kind for someone else in your day will make you feel better, immediately better, twice as happy according to UBC research. But it will also increase your chances of living healthier and longer and living longer. And so, to me, what's fascinating is a lot of these little activities that have a huge impact on your health don't get as much publicity, front page advertisement, as some of the latest studies that show something that improves your blood pressure by 10 points. And so I would say that anytime you see anything come out in the literature, unless the final outcome is an outcome that matters to you as a human being, look at the research carefully and see if it applies to you or not. And so in medicine, we call them patient-oriented evidence that matters. It doesn't matter whether your blood pressure dropped by 10 points, but are you feeling better? Are you feeling healthier? And health, for the longest time, by the World Health Organization, was defined as a presence of well-being, presence of social well-being, presence of mental well-being, and we keep treating it as the absence of illness. I would like to bring that message to more people and encourage you to start questioning some of the things you hear in the media about negativity. There's lots of websites popping out with positive news, which is not about being a Pollyanna, but it's about recognizing that while we hear more and more bad things happening in the world, the total number of bad things happening is actually decreasing. And we need to bring some of those positive stories that connect us. We need to reach out to people who need assistance, and that simple act of helping somebody else every day can make us dramatically happier. Thank you for listening to me this afternoon.